New Beginnings in Recovery is brought to you by New Beginnings Health PC Addiction Treatment Center. If you need treatment for addiction, contact us 24 hours a day at newbeginninghealthpc.com. It's a brisk evening in the city. Outside a corner diner, small group huddles for warmth, passing a bottle in a paper bag. Across the street, a paramedic team kneels beside a man on the sidewalk, Narcan in his hand. Inside the diner, the owner wipes down empty tables, wondering how much longer she can keep the doors open. This is harm reduction in real life, complex, imperfect, and deeply human. I'm Dr. Alfonso Brown, and in today's episode, we'll explore the promise and the pitfalls of harm reduction in crowded urban areas, where every decision touches business owners, police, hospitals, and those fighting to survive. The question: can we save lives without losing the community itself? Join us today. I think you're going to love this episode. Hello, and welcome to another episode from New Beginnings in Recovery. I'm your host, Dr. Alfonso Brown, and today we're diving into one of the most complex, controversial, and consequential issues facing our cities: harm reduction strategies for drug addiction in densely populated urban areas. On the surface, these strategies promise compassion, safety, and a pathway to recovery. But beneath the headlines, the reality is much more layered, filled with unintended consequences and clashing perspectives. Local business owners worry about public safety and customer trust. Law enforcement wrestles with balancing enforcement and empathy. Hospitals, they strain under the weight of recurrent crises, and for those living with addiction, the street can be both a refuge and a trap. All of this unfolds against the backdrop of a community searching for solutions. In this episode, along with a panel of esteemed guests, all of which who have been in recovery or work in the field, we'll examine not just what's going wrong, but also where common ground might be found, exploring the tensions, trade-offs, and possible resolutions from every angle. Stay tuned because the answers aren't easy, and that's exactly why this conversation matters. Welcome, everybody, to today's episode of Let's Talk About Addiction, Lessons in Recovery, and we are going to be picking up from where we were the last time. We're joined today by our esteemed guests, Mr. Mark Connor, Marcelin Pierre-Louis, who's a nurse in our clinic, and Mr. Joseph Lauper. Everybody just introduce yourself quickly and say hello.
Hello, guys. My Marcelin, the office nurse over there. You guys know me.
Yeah.
Nice.
I'm Mark. You guys know me as well.
Hi, I'm Joe, Mr. Lauper.
And Mr. Lauper. Okay. Well, and I'm, of course, Dr. Alfonso Brown. I'm the clinical director and the clinician, and I want to thank this very robust group for coming today. We started in the last episode, for those of you who are here, talking about a hypothetical situation. It's a theoretical one that we developed, but it's meant to mirror real world events that we're currently evaluating within one of the major municipalities in the state that we live in. So just to recap very quickly, in the last episode, we talked about a harm reduction approach, which took into consideration issues regarding public safety and the presence of an open-air drug market in the major municipality. And essentially what had happened was that a large number of individuals had congregated in a certain area of this large city, and people were using drugs openly in public, and they were largely left alone. And this was per the response of the leaders within the city. And the reason why is they wanted to reduce incarcerations, overdose rates, and hospitalizations by providing and implementing a harm reduction therapy in which individuals were provided with paraphernalia and other treatments to help reduce overdose potential. And also, drug dealing and things like that were discouraged, even though individuals would go there to use. There is a police presence, but again, it's harm reduction. So, no criminal activity is allowed, but individuals there are, are encouraged to seek treatment, which is also widely available. In very close proximity to the area, there's a large hospital. There's intake facilities with programs for drug treatment and treatment and also treatments for addiction. There are individuals who provide supplies such as clean needles and also clean up spent needles and other supplies. And as mentioned, there's a police presence in case unlawful or criminal activity such as dealing takes place. They're there and available to implement a law enforcement approach to treatment. So, in the first episode, we talked about the following question: does the presence of nearby services outweigh the harms of attracting more users to the community? And essentially, what's happened is that it has now become widely known throughout many surrounding areas that this is a place where this sort of thing could take place. And it's invited, either by word of mouth or by direct experience, many individuals who use drugs to congregate there. And at one point, there was actually a tent city that was present, which was subsequently dismantled. Um, so where we left off in the last episode was uh, initially when this started, the city rolled out its plan for how to deal with it, which we've also spoken about. And then there were local area businesses that began to complain. And they were reporting that their customers were avoiding the store because panhandlers were approaching them in the parking lot. Also, employees that were leaving at work were nervous about theft and or harassment. And the question we had asked at that time, um, should businesses be compensated when the city policy directly causes loss of customers, or is this just part of the urban tide? And we talked about that, but the question is sort of, if you were a business owner in that community, would you feel that this was not in your best interest? This was something that's being forced upon you, or this is just the point of doing business while you're there and you have to sort of come in and go with things.
There's no doubt in my mind they need some kind of legislation for businesses. I mean, you just see what's happening in California. They're all taking off because they're allowing people to steal from them and everything else. And it's unfortunate that the businesses themselves take the spanking for, the actions of the town or the city, but it happens all the time.
Mhm.
Yeah, I do think they should take some responsibility if they're going to enact, something that is so earth-shaking that it's going to affect local businesses like that for sure.
Everybody agree with that, or any other opinions? And thank you, Mr. Turner, for that.
Yeah, I pretty much agree. I don't know. There's also an issue like what could be done as opposed to like if they want to like leave or shut their business down, how much worse would that be to relocate or just completely give up? Like I feel like that's never a good alternative anyways.
Okay. All right. So that's another issue. It incurs some additional stresses as well as potential costs with relocation should they decide to do that. Is that correct?
Right.
Is that what you said? So, Albert? Okay. Yeah, and Marcin, what about you? Any thoughts on that?
I feel like relocation as far as a business owner for a situation like that will not be my first ideal, due to the fact that um you will always find situation where you have to deal with that. So therefore I will rather work with local authorities, see how I can, you know, provide,
Okay.
you
Yeah.
know, my participation as far as maybe reinforce a little bit of security.
Okay. So, if I'm hearing what each of you is saying, Uh, in one sense, you sort of side with the businesses that something needs to be done. They shouldn't just sort of accept this as part of the silly policy and let it play out. However, um, the exact mechanism by how they should implement this is still sort of unclear. And I just wanted to ask you, when you decide to set up a business somewhere, how much control do you think you should be offered over changes that happen in the community? Now, this is a little bit different than somebody putting up like a competing business or an undesirable business. Like, for example, if you had a supermarket and maybe someone decided to open up a strip club nearby, if you might be concerned about the trafficking, or a massage parlor with, unsavory means or something like that. I'm not saying anything about massage parlors. This
Right.
will be ones. And do you think that's a parallel situation? And
Uh,
should be allowed to complain about that, or push against that?
Right. Well, you got to think that there's got to be some realistic, goals when you're opening your business. And open and legal drug use likely isn't one of them, because that's the last thing you think of when you're setting up shop is, they're going to let drugs run rampant in this neighborhood and go, untouched. At least that's not something I would be thinking about. So it's like an unseen, it's almost like, getting tornado insurance here in New
Yeah.
England, and you know what I mean? It's just one of those things, but, unfortunately, it seems to happen in every environment where, there's a large clinic like that, Mass Ave, places like that, they tend to conjure, and businesses suffer for it, for sure, you know?
Well, an excellent point, Mr. Turner, which I think brings us to our next question. So, as this progresses, I mentioned that there's in our theoretical example, and again, we're not using names or places primarily because there are some things which parallel in various communities. We don't want to offend or make any of the individuals involved feel. But in order to have a very focused yet thoughtful discussion on this, we are drawing from actual elements that have been reported. So I want to ask, in our case, there is a very large hospital immediately within the area, and they have the capacity to treat the complications that are associated with what's going outside their doors. So over the last 2 quarters, what they've found is, since this has occurred, there's been a sharp rise in emergency room visits for overdoses. Also, some of the collateral was soft tissue infections, and also individuals suffering from withdrawal symptoms. They report being overwhelmed, but they're torn. And here's the reason why they're torn. They're overwhelmed because it's a lot more patients who are coming in because of the concentration of individuals within the area. However, uh, they feel that the constant overcrowding is reducing the quality of care they're able to provide for non-addiction related emergencies. And, they're looking at whether or not they should come up with another strategy, because if 95% of the people they're seeing on their emergency room shifts are drug related complications, they can't deal with some of the maybe not as critical, but just as important issues that other patients are trying to get in. There's also been some pushback because the emergency room wait times have increased dramatically, and other competitors are getting access to patients because they don't have the same problem that results in a prolonged wait time. What do you
Sure.
think about this? Is this a legitimate complaint, and what should they do?
Uh, I sometimes, and the perfect world, I wish, um, certain aspects of federal funds would be, put aside for. It's almost like you need two separate hospitals, honestly. A hospital to deal with everyday ailments and a hospital to deal with somebody that's fighting addiction, because they're really not one and the same. Granted, they're capable of helping you, like you said, no problem. But at the same time, they're not there to rehabilitate you like a hospital would if they were doing a heart transplant or something, to that effect.
Mhm.
So I think, looking at how people get treated, or maybe building hospitals that are strictly or at least on the level of people that are dealing with addiction, I think would be a great first step.
Okay. Excellent. Thank you for that response. And I guess to frame it again a little bit more clearer for our panelists, should the hospital be allowed to limit care for non-emergency addiction issues to preserve resources potentially for other patients?
Yes, I think so.
Okay.
I feel each hospital should have an addiction department.
Okay.
And because a lot of time you find a lot of healthcare practitioners in a certain hospital that not fully trained when it comes to the treatment of addiction.
Mhm.
And a lot of time they
Right.
really, and especially for the new graduate, they don't have any idea of those medication until second to their third years in practice when they start, um, encounter with them.
Okay.
And I realize
Right.
every time you have a new graduate, you talk to them about addiction, they have no clue. They always get so worried about it. They like thinking if they go work in a place where we're doing addiction treatment, people is gonna attack them or they're gonna be exposed. Like they complain about safety, which is very the contrary.
I see.
So I feel like the hospital should get more involved when it comes to that.
Okay. Well,
I
let
think
me ask you.
South Shore Hospital has made big progress as far as the bridge program, which
Mhm.
is a section they open directly address addiction treatment,
Okay.
and they're making big, tremendous
Well,
progress with that.
That's great.
I
Yeah.
agree with Mr. Turner on that level that hospitals should probably hire staff, or do
now,
something about it, not just for the medical, psych, and everything else.
Mr. Locker, what do you think?
Um,
Do you agree with
yeah,
what you said,
I
or
mean, I agree.
and who
It's
more
tough,
specific?
like on when you're talking about potentially turning people away, um, like as far as like addiction based or if they have some sort of substance problem. If they're coming in and willingly offering that information and then, they're being turned away, it might almost immediately turn into just, a perception thing. They might just try in a little while to come in with a different, story or version of events, try to bypass that. And then it comes down to sort of each individual. You have the staff there trying to sift through like what might be a legitimate health issue or well, not that addiction isn't a legitimate health issue. It's just if they're turning people away, it might turn into this sort of whack-a-mole situation where they don't know who's got what or if who's lying or whatever. I feel like that might turn into a tricky situation only if it's like a line in the sand, like if you're here for this, you can't come in, go somewhere else, like something like that.
Excellent points. So, just to
Yeah.
rephrase what you guys have said, do you sort of envision maybe a hybrid approach? Because Mr. Turner and Mr. Pierre, the comments that you made about setting up these facilities for additional treatment, that would probably be more like a long-term strategy for an institution that doesn't have that in place, right? Getting more people who are training, familiar, and setting up programs like a bridge clinic, like had been mentioned, and maybe in the immediate term, Mr. Lauper, as you were saying, if they had a specialty way in which individuals were triaged, or maybe they'd be given specific rules that once they got above a certain amount, maybe 50% or more cases, they could go on diversion to some of the larger hospitals, or other hospitals with the same capacity to help with that. I mean, we do this for other events, usually severe cardiac events and things like that. And even during the pandemic with COVID, if certain hospitals got overwhelmed, they had the ability to divert and to triage. So uh, that might be a solution for short term, whereas the implementation of bridge clinics, as well as additional training for future trainees in addiction services, long.
Yeah.
Um, I wanted to quickly just, move forward. So one of the other collateral problems here was that people have complained when they drive by this area, they see a police presence, usually out on the peripheries of where the majority of individuals are congregated, and officers within that police district, to some extent, voice their concerns that they feel somewhat powerless in some of these situations. And this has been a common complaint where large municipalities have implemented harm reduction protocols. They're told not to arrest just for simple possession, even though that might change. This is sort of the general directive. But theft and drug dealing are what people are complaining. They believe that they're rampant. And some dealers actually go down to that area using the thought that, well, that's where the people who need my stuff are. They try to um, disguise their activities, but they're in there amongst the crowd, providing a source, although in a clandestine approach. The people are getting.
Right.
So the question I have for the panelists: should the police be given more authority to act on drug sales and harm reduction zones, and would that undermine the goal of the city to have a trust building intent for their goals here? And if you,
Yeah.
uh, what do you recommend?
I think it would be really difficult for them to make any case. Considering the circumstances of the area, the so-called dealer is obviously going to say that he's not. He just uses recreationally. If there's maybe set amount, maybe he's got more than a half ounce or something, and then maybe they can take different, procedures there and say that's above personal use. So we consider that dealing and then charge them with dealing, something to that effect, I suppose. But then they'd have to go and stop and search. I don't really know how you go about something like that,
Yeah.
other than what you can see with your own two eyes.
Right. Anybody else? Do you think that any sort of increase in enforcement capabilities would undermine the principle of trying to build trust with the community in terms of intent? And if so, which community? Because as we're going to see, it seems like there. Do you think there's more than one community with a vested interest here? Which
Right.
community
Yeah.
are we talking about?
Yeah, it is tough.
Well,
I'm not really sure.
I, I, it's tough. I know definitely more police presence in an area like that will. Well, we not need to forget that any arm reduction situation, especially in a facility in an area, it's usually a place where people with addiction will go there, but that giving them an opportunity not to be all over the place too. And another thing too that will help them to be being somewhat monitored just in case of a pre-overdose. It's all about really prevention in a way, and
Mhm.
I give them time to move from you know, to change stage in the level of addiction. By being there, they being staying. It'll somewhat safe to move from to be prepared to actually go into treatment and at some point. I don't know if arrest will be in the word, but I think if there is more presence of law enforcement, it's basically mostly to monitor. Just keep things on the down low with them, and you will find people dealing. But at the same time, you just need to, you know, evacuate the situation and move along. But I don't know about more like, you know, arrest or give them more authority on, because this is just a way to get, these people somewhat safer
Mhm.
until they're ready for something else. And but by then, who knows? And at that point, you have a chance to have people that is training, that is ready to go there, talk to them, somehow, can take them from the level they are and change them to another level, you know, the preparedness for treatment. We can always have healthcare workers instead of law enforcement. Maybe more, it could be a new sort of, healthcare system just for that, where people can. It's just you never. It's like just saying you're never alone. That could be like like let's just say you set up some kind of phone call situation. If you are using, you don't want to be alone, call this number. There will be always a healthcare provider on the other line, just in case. I don't know if like more law enforcement authority give them more power to do more like arrests and stuff. I don't think that will help really.
Right. Excellent points again, Mr. Lauper. Doing anything?
Well, I mean, like it's like if it is bad enough, like if if it's obvious that something is happening and it's getting out of control past the point of like like someone coming in and dealing here and there, or a couple of thefts, or if it appears to be a growing problem that's obvious enough that you would think about maybe doing something to increase police presence or expand their authority in any way. I feel like you might have to do something. I don't know what that would be, because like you were saying, like it could very quickly backfire and the trust would be just broken. So anyone who was there to actually, like he was saying, have like a safer alternative than to just being alone, they might just abandon it, and you might end up causing more harm. It's like a really strange tightrope situation. But like I said, if it is obvious and that it's getting worse and worse and worse, like people will always try to find a way to take advantage of a situation. There might have to be some sort of something done. I don't know what though.
Okay. One point, when I'm not gonna ask you guys to answer this, just think about this point because we're just wanna get through the last questions here. What metrics would you follow to see whether or not this is being successful? I mean, we're assuming, but what metrics are actually should be followed? You don't have to answer. Just think about that one from now. That's a little bit more complicated, but how do you know what you're doing is being successful? You've already got two potential complaints. One is the business owners. The second is the police officers. Actually, there's three. The third is the hospital with services, and now we're going to get into the fourth. So relatively nearby the surrounding areas, there's one area that's sort of low income, lower socioeconomic populace, and that's actually a fairly large area. But there's also an area with very high end homes approaching the $1 million plus mark, relatively nearby. And there's new construction with condominium prices starting at $500,000 or more. That's within walking distance and definitely sight distance of this area as well. So this sort of gets out to now the people in the community. That's the group we haven't heard from because they are there. And a group of neighborhood residents organized petitions demanding closure of this harm reduction zone. They say enough is enough. They think it's destroyed neighborhood safety, and some call for, right, remember I mentioned the metrics. Some are calling for mass arrests. They just want people arrested and taken off the site. Others suggest relocating the services to a less central area, periphery, another town, sort of a shared responsibility type thing. So the question I have for you guys is, does moving the services solve the problem or simply push it into another area? And is mass incarceration a solution? You guys mentioned mass treatment, right? But what if the individual says, I don't want treatment? I like where I am. I just want to do my thing. What do you do with that sort of a person?
Well, that's why I think we need to change the approach to treatment, period. I think some of the countries that do well with addiction, when they have open addiction and they have very few addicts, is because this major expense and mental health that they spend. And like, we haven't really changed our way in how we deal with addiction other than, harm reduction therapy, I think, is the only thing that's changed in 30 years. Otherwise, it's the same thing, and mental health is never discussed, which is typically the problem, at least in 99% of cases.
Excellent point. Excellent point. Another thing I want to throw out there, you don't have to answer, just think about it. What should be the end game? Is it abstinence? Is it just trying to not get them to use? It is relocation. I just don't want you on the streets. You can go use somewhere else, just not here in the open because you're directly impacting the community. Anybody else want to comment?
Yeah, I suppose that would be the only free spirited way is, hey, do what you want, just don't do it here.
I mean, that
Yeah,
works to an extent. You have to ask yourself, where were these individuals before this became the major area to hang out to do this, right? So
yeah.
there definitely is a concern about that.
But Dr. Brown, would it be something like if you let's just say, okay, let's take that example, right? We know that we talk about more police present. We talk about increased security in the area, but at least we know where they are. And
Yeah,
then when you talk about, like, when you take example like Massa, right? If you wanna do something about it, you can put more cameras, more police officers, more healthcare workers in the area. But and when you have this individual all over the place, where now you having risk of some you know overdoses in Dunkin' Donut bathroom, McDonald's bathroom, all over any town, in the back of high school. I think it's more, for me, it's really harder to deal with,
mhm.
instead of when that, because even the harm reduction is a step where they can move toward treatment. And they're not going, if you force treatment in them, they're not going to follow treatment unless they're ready for it.
Okay.
One of the question, are you ready for treatment? Because if you're not ready for treatment, you are not going to be committed. You see, that's where I think, it's a complex subject, but at the same time, you can be, pros, and you can be, against certain part of it. But at the same time, there is benefit and non-benefit to having, you know, a specific zone where at least you can know that zone need to be more under surveillance, because that's where the majority of situation is happening.
I
Oh my
completely agree.
God.
And the approach too of not just abstinence, how they push addiction, especially in early addiction, is just be abstinent, you're fine. Don't, go to meetings and stay away from everything. They're not even touching the seed. They're not even near it. They'll say, I could use AA, for instance, that, they say don't talk about drinking and things that trigger you. Meanwhile, that's all they do. And it's just, there's no real structure in terms of how you're supposed to move forward, and this is what people are told to do. They don't know where else to go, so they end up going to, and I guess Narcotics Anonymous meetings are notorious for it, just dealing drugs right there in the meetings, and it's really what's getting accomplished. Absolutely nothing.
Very powerful points, gentlemen. Very powerful points. And Mr. Turner, you've given me a little insight from maybe some future discussion. That was an interesting, very powerful statement there. Mr. Locker, I'm sorry, did you have something you wanted to say?
I gotta go. I'm at work now. I just clocked in. I figured I'd hang out as long
Okay.
as I could.
Okay. No problem. Thank you. And we're gonna wrap up. We've got just a few more comments, and I just want to thank everybody. There's been an excellent discussion. These are very complex issues that actually, even now, are significantly influencing a lot of major political races, because these have been hard questions.
Right.
But the goal, as you know, of this podcast is to show how people in recovery can think these things through at a much higher level than a lot of folks would imagine, and are able to do outstanding things with that. And I'm very, very thankful again for your input. So we'll just try to finish up these last ones really quickly, and then we can end this topic, I think. Um, so we've talked about the implementation of these problems, the issues with the community, law enforcement, the hospitals. And I also asked you if you remember about metrics for how we were determining whether or not we're successful. One weekend, some of the reports from the administrators who oversee this is that, oh, things are going well. We've reduced the number of overdose and presence of people who are using in other parts of the city. They're being monitored, as sort of what was mentioned earlier. But then all of a sudden, there's a significant string of overdose deaths. And this is investigated and found to be traced back to a batch of fentanyl laced drugs that hit the market. Um, now, despite this increase in overdoses, Narcan distribution prevented several deaths. Um, but once the media got a hold of these deaths in the area, it reignited debate again about what was actually going on here. Uh,
Yeah.
and and how do you prevent, in this case, dangerous drugs from circulating that could create a problem like this? And recently, this has also come up because there's a form of a horse tranquilizer that was making its way into the illicit drug system, and people were coming in with severe necrotizing skin-related infections from injections with this. So here's the question for you guys again. Should the city partner with law enforcement to track and seize dangerous drug batches, even if that increases in arrests? Or again, should we rely on the methods that have been set up? And how does that call get made?
I know, we don't mass incarceration is such a big problem, but so is drugs. So it's just one of those things I feel like you gotta really go at it full force. I think we're doing a better job in terms of what's coming over the border and stuff, but that doesn't mean people aren't gonna set up labs here in the US. Yeah, I mean, tracking people down, it could be someone small, but you don't know who he could lead you to. And, I think if they really did their due diligence, plenty of task force out there, they'd probably do a pretty decent job of cleaning up a city, at least, like to the best of their capabilities anyway.
So you think they should step up the pressure in those sorts of situations? See if we can get
Yeah.
the source. Okay.
I agree.
Yeah.
All right.
Mm,
All right. So there's
Definitely.
there's agreement in this, and yeah, this is a reality. I've seen it even in our clinical practice for a while. We had an influx of uh, methamphetamine that was impacting the Adderall. So some patients were taking this, and it was showing up as meth usage. Fortunately, whatever they were using, it didn't seem like it was severe in terms of side effects, but we had several discussions and tried to implement treatments to help people overcome this. And it was very hard to distinguish it in the articles that I read and discussions from the regular Adderall. It was kind of,
Yeah.
it's like,
Um, same with a friend of mine bought the cocaine, or at least that's what he thought it was. And he's never touched fentanyl in his life, and it was just that first line that he did that it put him out. The ambulance had to come and everything, and he said they put it in everything, and
Mhm.
for whatever reason, it's cheap to manufacture.
Yeah.
But
Isn't it
that's
interesting though? You'd wonder if you're a supplier, your job is to keep the person you're supplied to alive long enough to keep coming back, right? So if you put stuff in there that could kill them, you're sort of, but I guess it's just something they don't think about. All right, just to finish up now, this continues to progress even further. Several small business owners form an alliance, and they propose the following proposal. You guys just tell me what you think about it in 1 or 2 sentences. They propose a private security force to patrol the area, and these security individuals would carry firearms as well. which can be allowed, and they would be able to, initiate arrests on behalf of the business owner. So, city officials worry that this could lead to profiling and potentially escalate tensions with homeless individuals. So, the questions for you guys: should private security be allowed in public spaces, or does this create a two-tiered system of law enforcement? The other thing is, who do they report to, and who sets the criteria in an intervention?
I have really no problem with having a kind of a not a private police force, but yeah, right. I mean, I guess security, to the extent where they're able, they get their fee from whatever store, block, or area they're protecting. They have to follow the law to the letter. They get obviously have their carrying permit. In terms of arrests go, I don't know how that's made, but you can make arrests. A citizen can make an arrest, so I don't see why the security officer couldn't either. Um, that being said, I can see it turning into a disaster. With unions and all that.
Right.
And in addition to that too, I think you have to be really careful on how the security guard will be educated about. Even the law officer will have that spend months in the task force. They show so much the wrong use of authority against the population, even though they go to formation for like years. And when we're talking about giving police officers, security officers, the right to arrest and use force, that could turn into a civil war if like because people don't know how to use power most of the time.
Yeah.
And they will start abusing people that is even innocent. I mean, profiling the wrong people, like thinking they doing the drugs, dealing the drug, but they were just in the area. So therefore,
Right.
there
That's
could be
what
a
I
lot
mean.
of
Yeah. Yeah.
Excellent. Very complex. A city council member proposes the following ordinance. He says, okay, well, if you're going to try to put restrictions on the security alliance that the businesses are trying to hire, remember I asked you about the metrics. So he proposes the following metrics. Anyone who receives Narcan more than twice in 30 days would be required to enter treatment. They have no choice about that. And and if they refuse, then they could be incarcerated for the treatment. So the harm reduction policies would be removed from them if they had this thing. So they would track usage, interventions where that has to, and then if someone overdoses more than twice in a 30-day period, they would be forced to go into treatment. Now, advocates argue this is uh, it's ensuing what they call compassionate accountability, and opponents call it coercion that violates the personal autonomy of the addicted individual. What do you guys think about that? Is that an appropriate solution here?
I think it's useless, and I'll tell you why. Just for the amount of time that the person's not using. I only know this because I've counseled and I've had friends that have been sectioned many times and they've gone through this. And most of the times, these facilities are very low end. They're not putting any stock into you. You're just taking up a bed, pretty much. And if you're battling with something, you get some inner demons, they're just stewing up. The second you get out, you're going at it twice as hard usually, and it's just a never-ending storm. I see people come out more resentful. I've seen families break up over it. So it's like, yeah, you'll take them out of their situation for a little while, but if they're not in the right place, it's it's killing time. That's all you're really doing.
Huh.
Beating a dead horse.
Marcin, you have any thoughts?
um. I think
Yeah,
this. I agree in some percentage, but it's always could be different turn around in certain situation. Like when people get in overdose once or twice, then it becomes a safety issue with your life too. So if you were forced to go away in the treatment for a certain period of time, I probably would be agree with that because when it comes to safety in the hospital, they always take the patient right. Like if you said I'm gonna kill myself, you're not gonna leave this facility. They're going to admit you to psych immediately. So then it become a life and death issue situation. Who knows that? Who knows? Maybe while you're away and try to get your treatment, you'll be sober for sometimes. You might have a small percentage of people that turn their life around. While
Yeah.
they
Well, what
doing this
happens is
trial.
people come out and they use the amount they were using before they went in and they overdose and die. And this happens all the time.
Yeah,
So they'll come out of their 30-day, 90-day stretch, and they'll come out and they'll do their dose and they'll overdose and
they
they're out.
they're more
Uh,
vulnerable
and
at this point. Yeah,
you know what I mean? So
yeah,
it's like
that's a fact.
Mhm.
yeah, it's difficult.
Well, you guys have done an excellent job. I'm going to end with this final question. Okay. So remember, I asked in the beginning, I think one of the overarching things was, first of all, how you felt about this. And then how do you measure whether or not this has been a successful program or is it working? So one man, Jason, begins attending treatment after months of using in the open air market. The media picks up on his story and it's celebrated until, unfortunately, he relapses and he overdoses right in front of that fast food establishment that had lobbied the initial complaint. This reignites business owner outrage and raises questions about what counts as success in harm reduction. Now, this guy was the poster child for success, and then unfortunately, he has a relapse and he dies in front of one of the places that started the business owner related complaints. So, the question I have is, should harm reduction be judged by overdose survival rates, treatment enrollment, reduced crime, the optics test, which is less people on the street in a given area, or some combination? Or are we just not there yet?
That's what I would say. Maybe we're just not there yet, or a combination of all of that. I see exactly what you're saying, but it's so difficult to put it into category. Um, 'Cause you can see, I mean, I can see it, you can see it,
Mhm.
but the big picture is kinda hard to say, "Listen, this is." I push it to a lot of people that are struggling because I said it'll give you time to get, it's ju I always recommend therapy too. You need to talk to people. I said you need time, and you just don't have it when you're using because you could be dead tomorrow. You just don't know.
That's an excellent
So
point.
that's why I'm an advocate for the harm reduction,
Yeah.
but,
So
a lot.
time is an essential component. Definitely, they
Yeah.
have to have time. And
Oh, yeah.
I agree. Should so anybody who's out there be someone should go and say, okay, not to say this, but sort of some sort of an identification. Okay, if you're going to be out here, we need to document that you're at least moving in the direction of treatment. Otherwise, you're going to lose the protections of this harm reduction initiative.
Right, something like that, you know what I mean?
What if the
Yeah,
person says, I'm just not ready? I don't want to go into treatment yet. Too restrictive. But I'm glad at least I'm not overdosing when I'm out here.
Yeah,
I think you have to have a
yeah,
time
yeah.
limit. You have to have a time limit on this.
Okay. So
Yeah,
you're
if
agreeing with
if
this
if
30-day ordinance then?
it's some
Uh,
yeah, it
that
cannot
was
be
with
like
overdose.
you in here forever. I mean,
Yeah, I had a patient call one of these areas. They called it the vacation spot because everything was there. The drugs, they had housing, which was open air housing on the street. They had a community, other people who were like minded, and they had treatment if they needed it. And anything ranging from hospital visits, medication assisted therapy or incarceration, which some people view that as a way you can detox sometimes. So all of these were there, and they said I had no reason to leave this area. This works for me. But while they're there, should they be allowed to just continue, or should they be required to document in one way or another that they're utilizing this harm reduction strategy to move things forward?
Yeah, I'd probably say, yeah, I document it and, um, change would have to be implemented. Like, yeah, you just said it a couple of times. We're just not there yet. I don't think, I think we're trucking forward, but as a whole, I just don't think we're there yet.
Okay. Excellent.
And it's too bad, but it's individuals, just like we're doing right here. Like this is honestly the best thing you could be doing. You need people to hear and people to understand because they're going to go and do the same thing and keep spreading the word. And that's actually how you end up getting successfully sober. Is it's tidbits. One person said one thing and it made you think this, and until the next thing you know, you're yourself again.
I agree with you, and I just want to thank you guys, each of you. It's very complex. We took the best of the best because these questions you're getting are not simple. They're very complex. They've confounded a lot of people spending a lot of time and energy. And as we're going to close here now, I just wanted to wrap up. Leave these final things. Some of the key points that were discussed today. So we talked about what should be the primary measure of success for harm reduction in the neighborhood. And the other question to think about, is there a middle ground that can be established between open tolerance and aggressive enforcement? And if that middle ground exists, how should it be implemented? Also, should cities and major municipalities prioritize public health over business concerns or vice versa? How should that that power sharing occur? Who gets the loudest voice at the table in that situation? And what if there are differences amongst communities? What if one community, I mentioned, one of the communities where this is occurring is very poor, whereas another one is very affluent? Sometimes those communities might have different views about what's important. If you paid $2 million for a property, do you want somebody using drugs 3 blocks down from where your house is? Versus if they're from your neighborhood, you want to see them incarcerated. Um, the The final 2 discussion questions are: can safe consumption sites coexist with thriving local businesses? Is that a model
Grandma,
that even
it's
makes
falling
sense
down right
if
now.
you're a
What's going
business
on?
owner? And
Not so much to me. I can't. Just the idea of a safe consumption area to me doesn't really settle right because they're not. And they never really have been. There's always going to be problems. There's always going to be overdoses, unfortunately. And
then
I think
go ahead.
I understand. It's like they need they what they're trying to do is manage a really difficult situation. So I mean, you understand that from a standpoint of a politician, but I mean, what you're actually doing, I don't know. I don't think it's a great idea.
Okay. The final thing is, who should pay for this? It's everything costs money, and there's a lot of money here, especially with some treatments that seem like they're open-ended. City,
Yeah,
business,
there
state municipalities, federal government. Um, Again, something to think about in terms of a complex issue.
absolutely something to think about it. They can move money around if they need to. You don't see a ton of mental health lobbyists in Washington D.C.
Maybe they have too much work. Uh,
Like, yeah,
Start using their
seriously.
lobbying, but well, I want to thank you all for joining this week. This was an excellent discussion. We'll be here again next week. New topic, new discussion, and trying to wrap our head around some of these issues as they impact individuals, both in the community, at the legislative level, and also in any other area that the issues related to recovery and addiction can impact our personal space. I want to
Fantastic.
thank you all for coming and have a wonderful day. Take care.
All right, thank you.